Hello, I'm Dr. Obey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, remember the famous phrase of sharing and caring. Let's care about each other. Let's share our medical information with each other and let everybody know. If you have hypertension or your doctor is talking to you and give you good information, then share that information. Make sure your neighbor or your brother or sister go see their physicians so that they stay up with their medical problems. And that way we can all be healthy. All righty? Well, I'm so glad about the website. People have been going to the website and looking at all the medical information that's on there. It is www.obeyyourdoctor.com. And we have Facebook, we have Instagram, and we have all of the social media out there as well. So check us out. It's all good. All righty? Now, let's talk. The last show, I talked about health, wellness, nutrition, and fitness. And I think it's such an important topic that I want to cover it again. All righty? What we're talking about is we're talking about being healthy. And I truly feel that in order to be healthy, you need to be the appropriate weight for your height. If you can manage to keep your weight down, then you decrease diabetes, hypertension, heart disease, some cancers. All of those have a chance of decreasing. So it's so important to keep your weight down, eat healthy. So here are some things we can do. Exercise, be active. 150 minutes of moderate activity or 75 minutes of vigorous activity per week. That's for adults. And if you can do more than that, that's even great. As far as eating, you want to eat more plants and vegetables, all righty? I know you love the pasta, you love those pizzas and things like that, you love the rice and the bread, but all of those are carbs and they have a lot of calories in them. And if you eat too much of it, guess what? You pop and plump like a ballpark Franks. You're going to just get big. So we don't want that. We want you to be nice and lean. We want you to have the appropriate weight for your height. All righty, so we're eating healthy and also being overweight or obese, there's an increased chance of cancer with that. So we want to really bring down our weight. Okay, and don't supersize, because if you supersize your meal, you're going to supersize yourself. So no supersizing out there. Limit processed foods like hot dogs and stuff like that, and try to decrease your red meats. Let's stick with the lean meats like chicken and turkey. Eat about 1.5 cup of vegetables or fruit per day. And stick with the whole grains. You know, things like barley, things like oats and brown rice, they're the most healthful for you, all right? So we're talking about health, wellness, and definitely nutrition and fitness, all right? So we have an interesting show tonight. And it's one that I like because we're going to take it a little light tonight because we're going to cover several topics. And the title of the show is Common Medical Problems. And I just want to touch on a few things like hypertension, diabetes, heart disease, those type of things that most of us, sometime in our lives, we're going to experience some of this. So we should really, really know what's going on. I have the perfect person back again. He's been on the show several times, and he's a internal medicine specialist. He's at Newark Beth Israel Medical Center. I'm talking about Dr. Dean Rice. Dr. Rice, welcome to the show.
Thanks for having me again.
All righty. I'm telling you, I'm just so happy because he always takes time to come on the show because health, education, and wellness is so important to him. And I'm so happy that you made the time to come to the show once again. All right. So what I want to do and how we're going to handle this is, last time you were on the show, we actually talked about things that you should talk to your doctor about. Mm-hmm. But we didn't get a chance to talk about several because we so much to talk about, we didn't get a chance. I just want to go into that just a little bit. When you go to your doctor, are there certain things that you should kind of bring with you, or to let him know what's kind of going on, and you know what I mean? Or, because I love it when they walk in the door and say, yeah, I take the blue pill and I take the green pill. So tell me about this.
Well, that initial interview, it makes it a big difference in terms of what the outcome is going to be with your encounter. Mm-hmm. So it's very important that you have all your insurance information. You should look into what your insurance offers and that kind of stuff. Mm-hmm. But certainly bring your medications. Right. Bring a list, if not the pills themselves, and have some knowledge about what has been happening with you in the past several weeks, months, years, and be able to give some kind of time frame. Mm-hmm. It's important that you not hold back information. Everything you say in the doctor's office, as you know, Dr. Bay, is confidential.
It's confidential.
If in fact you want to speak about something that you don't want documented in the medical record, your physician will be more than willing not to put things down that you don't want, but they need to know. We need to know.
Right.
We are your best friend at that point. Right. So I had a patient come in yesterday who didn't tell me about a very important test that he had performed that was significantly abnormal, that would have helped us go through the encounter, and I have to find out from his sister, like 2 days later, that he had a test done outside that I should have been addressing. So it's very frustrating not to get the entire story or all information. You got to take the time and have the trust that when you go to the physician, right, to tell them what's happening, tell them the truth, and let them know what can be shared and what you don't want shared, but have that interaction.
Right. What if you don't speak English? And the doctor doesn't speak your language. Well, does that happen very often?
Yes, it does happen. It does happen. And people sometimes come alone that don't speak English. And right. I speak a little bit of Spanish, certainly not enough to get through an entire encounter. We have something called the language line, which is available, which people volunteer. Mm-hmm. You dial in a particular phone number and there's another person who speaks whatever dialect it is. And it's very helpful. But overwhelmingly, if you have someone who has limited communication, right, it's best that someone who cares about them, we call them a significant other, family member, spouse, child, accompany that person to the encounter so that adequate communication can transpire.
All right. Another thing, allergies. Medications, food allergies. How important are they?
They're very important. Very important. If you have an allergy, and what we see as healthcare providers is we want to know when someone says, yeah, I have allergies, most commonly, overwhelmingly, penicillin. Mm-hmm. This person comes to your office, you offer them a particular treatment, and then you ask them, do you have any allergies? That's one of the primary questions in any history and physical, any evaluation. Right. I have an allergy to penicillin. The next question is, what happens when you take penicillin? Right. You'll get patients that say, oh, well, I don't know. My mother told me when I was a kid that I couldn't take penicillin. You're cheating yourself out of a great medication because penicillin is involved with a number of different kinds of medications, all the cephalosporins and different kind of antibiotics. Mm-hmm. So you want to know what happens. Did you itch? Did you get nauseous, which is not an allergy? Mm-hmm. It's a side effect. Right. Or did you stop breathing and develop swelling that you couldn't speak or anything? Right. That is a true allergy. That's anaphylaxis, as you know, Dr. Beck. Yeah. And we will, under no circumstances, give you anything that's even related to penicillin. But allergies is very important to know. And what happens when you take a particular medication like shellfish or penicillin or sulfa, things like that.
Okay. Screening tests. Yeah. All right. Doctor wrote out all these prescriptions, and I can't read them, and I don't know what they're for. Should they ask you what you're writing? What's this test for, Doc?
Yes. Often when we do screening tests, and they're required now for primary care, we're obligated to do a certain amount of screening for people depending upon age appropriate and sex appropriate. If the patient doesn't know what they're asking to have done, it's almost impossible for the healthcare professional who's going to perform those procedures or the insurance company to give them the opportunity and to reimburse for it. Mm-hmm. So yes, it's very important that you understand what everything says. So if someone says you're going to need a pulmonary function test, I remember before we had this study about the tubes and the tissues and things like that, you need to know what in fact is going to happen and what kind of preparation you need for a particular tests, screening tests, colonoscopy. You need to know that you need to clear out your bowel. You're going to be there half a day. You need a ride home. You're going to be a little bit drowsy after. So yeah, it's very important that when you leave an encounter, regardless if it's with a primary care physician or a specialist, that you understand what's next, so that you'll be able to do it.
Alrighty. I know a lot of patients come in and they really, well, let me ask it this way, family history. All right, and talking, is there a family member that maybe, does anybody have, I always ask, does anybody ever have asthma or something like that? And they give me this kind of roundabout answer. How important is family history?
Family history is very important for particular conditions. Some are directly related to family history. Sickle cell anemia, for one thing. Diabetes runs in family. Hypertension is familiar to a certain extent. So it's very important that you know what happened to your direct relatives, mother, father, sister, brother, especially. Grandparents certainly will tell you what's going to possibly, you'll have to look into in the distant future. Obesity is certainly something that tends to be familial. So family history is very important. And you should know, you should ask. I know a lot of people say, well, somebody was sick, I didn't really ask because it was none of my business. It is often. So that's important.
Okay, let's get to some of the diseases that are very, very common. And you just said diabetes. I mean, that's so common at this particular point, especially in certain cultures, that I just feel that we need to cover this, at least peripherally, we need to cover it. Tell me about the types of, like type 1 and type 2. You always hear this thrown out. What does it mean, type 1 and type 2?
Well, they distinguish diabetes in terms of whether you require insulin or whether you don't. Insulin is used for people who don't require insulin, but it helps dramatically. But there's a certain subsection of the population who does not produce an adequate amount of insulin, or they have antibodies to insulin, so that their own insulin doesn't work.
Okay. You hit me with a couple over there, right? So they don't produce insulin, meaning that I know the insulin comes from the pancreas. So you're saying that organ is not secreting, it's not doing its job. It's not secreting insulin into the blood.
Right, not enough.
All right. Antibodies. What are you talking about?
You can have special cells in your body that get rid of the existing amount of insulin before it can work.
Before it can work. They destroy it. These antibodies destroy things. So they destroy the insulin before it works, actually. Oh, all right.
So that would be insulin-dependent diabetes. That's rare. That's less than, they say, about 2-3% of the population at the most. These people require insulin. Without insulin, they will die. They'll develop acid in the blood, go get in a coma, and have high blood sugars, which can't be treated. And it's universally fatal if an insulin-dependent diabetic does not get insulin. That usually happens in childhood. So you don't really usually develop the dependence on insulin in adulthood. It's usually throughout the lifetime. Then there's what's called non-insulin dependent diabetes, where you don't produce enough insulin, or you're just your end organs are resistant to the amount of insulin that you have. So you need another medication to either increase the amount of insulin that's secreted, or to make your end organs more sensitive to the amount of insulin that you have, or you need to have some more extra insulin given to you to make achieve wellness and achieve adequate stasis in your blood sugar, or to keep your blood sugar in the 100 range.
Right.
So the insulin-dependent diabetic is certainly more fragile, but both of them can be life-threatening.
Right. Well, so what'll happen is if you don't have enough insulin, or if you're not taking medications to stimulate the pancreas to produce insulin, your blood sugar shoots up really high, and then you can go into a coma. You can get acid in your blood, really bad.
The same as someone who is dependent upon insulin.
Right.
And as you mentioned, nutrition, weight control is primary, is the key now to avoiding this necessity for external medications to keep your blood sugar down.
Okay, all right then. Now, some of the problems that can come about because of diabetes, what are some of the organs in our body that are hurt because the blood sugar stays high all the time? Like, I know the vision gets a little blurry and the eyes can be hurt, but I think there are other organs that are hurt by high blood sugar too, right?
Yeah, well, every organ that receives blood supply is affected by the amount of glucose or sugar that's in the blood. You know, when people present with hyperglycemia or high blood sugar, one of the first things they say is their vision is blurry.
Right.
And I'm just going to the bathroom constantly, having to urinate, and I'm always thirsty, and I need to eat. So these are the end organs kind of telling you that there's something off.
Now, when you say end organs, you're talking about, you know, your heart, your liver, your pancreas, your kidneys, your
eyes,
colon,
blood
everything.
vessels.
Right.
Yeah.
Okay.
So it affects every organ in the body, and it can be devastating. And a prolonged period, I mean years of elevated blood sugar is going to take its toll one way or another. You're going to have some significant end organ damage or organ damage, and it usually happens with the smaller blood vessels in the body. So that's why the first thing that goes is your vision.
Right.
So often when people present with a new onset of diabetes, they have blurred vision.
Right.
And there's no use trying to fix the vision because it's going to stay terrible until you correct the blood sugar. So we tell people when they come in, I have blurred vision and I've been urinating a lot. It's easy. You know, first year medical student, you check the finger stick blood sugar, it's elevated. So we tell them, don't even go to eye doctor. I know you can't read now, you can't work, you can't do what you need to do, watch TV. Don't waste your time getting glasses or having any kind of refractory or visual deficit fix, because it's not going to help until we fix your blood sugar.
Until they fix the blood sugar.
Small vessels in the kidney cause an increased amount of urination. You spill glucose or sugar in the urine.
Yeah.
And long-term effect is kidney failure.
You mean like dialysis?
You go on hemodialysis.
Oh, man. Yeah.
For the heart, it makes the blood vessels less compliant, and it makes the heart have to work harder, and you get cardiomyopathy or an enlargement of the heart, where the heart is not functioning as effectively as it should. Certainly blood vessels in the extramenities, nerve damage with this tingling.
In your feet and your legs, you mean?
Yeah, especially,
Yeah.
You lose sensation in the feet, where people, and the blood supply to the distal organs, the toes. That's where often, not, it's very much heard of that people lose toes.
Oh, you mean by amputation? Like they amputate the toes
and they
the
first
feet
starts
and
with the toe. We call it serial amputations.
Right.
And it's almost 95% of these people have problems with their blood sugar.
Right.
So it attacks every organ in the body.
Oh boy. All righty. Let's go to our other favorite one. High blood pressure.
That's the two.
Yeah, high blood pressure. You know I
That's
love
the double.
that. Man,
that was my first show on your show.
Oh, was that the first show?
Was.
Well, we're visiting it again. I just love my fried chicken. Yeah, that fried chicken tastes so good, and it sent my blood pressure sky high. Tell me about high blood pressure.
High blood pressure or hypertension, it's manifest by an increased amount of pressure of the blood circulating through the blood vessels. And it's what we call a silent killer. Most people are asymptomatic, and they come and have a regular appointment, put the blood pressure cuff around the arm, and then you can tell when the blood pressure, an average blood pressure of 120/80, we really start to get very, very concerned when it's over the top number, which is the systolic, is over 140. The bottom number over high 80s, 90s certainly. When those two numbers are elevated, or one of the two numbers, then we call that hypertension, and that has a very similar effect in diabetes. It attacks just about every organ in the body.
Is high blood pressure one of those that if your mother or father had high blood pressure, you should be considering, you should always go to your doctor and get it checked?
Yes, definitely. Definitely, it's familial.
All righty, it is familiar. And some of the things that may cause, I know stroke is one thing that, that is so devastating. And I think that's associated with blood pressure as well,
Certainly.
right?
Yeah, that's one of the end organs. That's one of the end stages of an accelerated or uncontrolled hypertension. Kidney disease, much the same as diabetes. It's all these blood vessels that are damaged from, in this case, high pressure, from diabetes, high sugar, or increase in the amount of glucose. So the very similar things that happen with diabetes will happen with high blood pressure or hypertension.
Okay, all righty. Now, there are certain things that I know that we can do that will help prevent or decrease the likelihood that it'll become severe, these type of diseases. Things like exercise, getting the blood flowing, getting up, being fit, and keeping our weight under control, eating healthy, Stopping smoking. That's a
smoking,
big one. That's
yes.
that one. We need to wave a flag on that one. Because smoking, I'm telling you. Well, tell me about it. How many things is it related to? Is there one thing that smoking does good? I mean,
no, there isn't. I understand how people think they're cool by doing it, but everything that happens to the detriment of the body, that hurts the body, is multiplied by smoking because it causes the blood vessels to constrict.
Right.
The tar and the nicotine, the tar gets in the lungs and causes you not to be able to exchange oxygen. It causes a decrease in the blood circulation in the brain. It inhibits everything that has to do with wellness.
Right.
So, and we're on a push to try to get people to stop. And when people can't, it's very difficult to manage them with all the other things, modalities that we have to offer.
Right.
But it's like if you're trying to help someone that has this underlying illnesses and they're smoking on top of it, it's a very frustrating process to try to have them maintain wellness.
Right. And some other things that may, I call these my the 5 do lists. So with exercise, eating healthy, stop smoking, get enough sleep.
Yeah.
All right, do that. And control your stress if you can. Yeah, because stress, boy, I'll tell you, I've seen some bald heads come walking into the office just because of stress. You know what I mean? And you see the white, right? You see the white. Right.
We earned it.
The gray hair here. Yeah.
Yeah, we earned that. But stress contributes because what it does is elevate your blood pressure.
Right.
And it causes your epinephrine or your adrenaline to increase your blood sugar.
Right.
And it hampers all of the other processes that help you maintain wellness. Now, how do you avoid stress? That's between yourself and the therapist and doing things that you really enjoy. But if you can't, then all these other things are much more important. Then if you have a high stress environment, your job stressful, your home is stressful, managing children, work with your boss. If you can't manage that appropriately, then maybe you should cut down on alcohol intake, food intake. Maybe you have to lose some weight. So you have to weigh these things. The things you can control, you should. For the things that you can't, if you have high blood pressure, you have to take medication, try to avoid stress, but you can't overeat, you can't smoke, you can't get drunk often.
At least not too often.
So these are things, you try to control the things that you can.
Right, I hear you. Let's talk about surgery. I know you're an internal medicine doc, but there are certain things that I think, as far as being a physician, that a patient should ask a doctor, because surgery is a big deal.
Yeah, it is.
You're saying, hey, listen, I want you to come into the OR. I'm going to put you to sleep, and I'm going to open you up and do my thing. There's some questions I got to ask.
Yeah,
I'm sorry.
There's a lot involved. But first, they're going to tell you, get a good night's sleep.
Yeah.
Come in wide awake, and then I'm going to put you back to sleep. So it's not a natural event.
Right.
It's not, and it's very taxing. It's very stressful on people's heart. And on their lungs, and depending upon what other things are happening. So it's a big decision, and it's not to be taken lightly.
Right. Now, before surgery, is it required sometimes to actually go to your other doctors and get clearance so that you can make sure that you're healthy enough and you can get through that particular surgery, especially if it's a big surgery?
Yep. And especially if it's elective, that emergency surgery, if you had a stab wound, a gunshot wound, and without a particular procedure being done, you would certainly not survive. That's one thing.
Right.
But most other surgeries are relatively elective. They can be done today, a week from now, or a month from now. You want to optimize yourself. You want to be optimized.
Right. You want to be the best you can be.
The best you can be. You want to be in the tip-top shape as well as you can be to go through that stress. And it's an enormous amount of stress to have even what we call routine surgery.
Right. Now, the surgeon obviously should explain the procedure. That, like you said, colonoscopy, come in, we're going to take this medication and clean your colon. This is what we're going to do. That's a mandatory, right? All righty. Recovery time, all right? And things, for instance, you go in and you have a procedure. You should want to know, how long is it going to take for this to heal? When can I go back to work? When can I start eating again? Those type of things. how do we communicate those as ask the question as a patient and communicate it as a doctor?
Well, you should. Every surgery is different.
Right.
So open heart surgery certainly is the biggest.
That's big.
And when you have a heart bypass and a heart valve surgery, these things put you down for weeks,
Right.
months at a time. You'll be bedridden for a significant amount of time, and the more you stay in bed, the less you exercise, the more it's going to be difficult when you start to get back.
Right.
So something like that will take weeks to months maybe, and a relatively easy laparoscopic surgery would take a short amount of time. But the answer to that is usually the experience of the surgeon will tell you, the person in your condition, your age, with your underlying health conditions, you should be able to get back to walking after a certain amount of time, back to work at a certain amount of time, back to heavy lifting at a certain amount of time. You should understand all of this stuff before you go.
Right.
And know how much time you have to take from work, how much time you have to tell your spouse or your children, please don't jump up on me.
Yeah,
I can't take you to school tomorrow, that kind of stuff. So it requires an enormous amount of communication, and depending upon the underlying health concerns, you may have to have clearance with your primary physician or your pulmonologist or cardiologist when the surgeon talks to you about that.
All right. We got about a minute to go.
Yeah.
And I wanted to cover heart disease because that's another big one. The thing about this is that if you live long enough, I think we're all going to have some heart problems.
Yes.
All righty. But the thing of it is to live long enough to have the heart problems. All right. So tell me about some of the symptoms that we should look for if you think you're having a heart problem.
Well, I think what you're really mostly concerned with is coronary artery disease, probably, and as you know, with cardiomyopathy or weakness of the heart, one of the number one killers is acute heart attack, which comes from coronary artery disease.
That's blocking of the arteries that feed the blood to the heart.
To the heart, right. So the blood is an organ, has its own blood supply. So although it pumps blood, that part of it doesn't really count. It's the blood vessels that supply that muscle, and all it is a big muscle.
Right.
And if those blood vessels get blocked, part of that tissue can die.
Right.
And when it does, your heart doesn't function adequately, and that's when that can cause sudden death.
All right. We're going to have to end it there. We've run out of
I heard the
time.
music.
Dr. Rice, thank you once again.
My pleasure. Thanks for having me.
Such a pleasure. All right, guys. In closing, what we need to know is sharing and caring. Remember, let's care for each other. Let's share. All righty, share out there. All right. Never institute any change in your medical care unless you consult your physician. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all. All right.